Welcome to the Flourish podcast with Dr. Tony Ingram, where you will hear straight from some of the best practitioners and leaders in wellness on how to take control of your family's physical, spiritual, and mental health, because we were all designed to flourish. As a reminder, this show is for educational and entertainment purposes only. Nothing said on the Flourish podcast should be taken as medical advice. For your own specific medical advice, please always consult with your own healthcare providers. Now, today I am super excited for our guest. We have Dr. Tanya Paynter. Dr. Tanya Paynter graduated from the University of Washington with a bachelor's degree in cellular and molecular biology and a minor in inorganic chemistry before attending medical school at Bastyr University. She graduated in 2012 with her naturopathic medical degree and has been treating women with chronic migraines for almost a decade. Having suffered from chronic migraines herself for nearly 20 years, she has a God-given calling to help women find a way to manage their migraines more effectively. She is the founder of Migraine Mastery, a 24-week online program designed to significantly reduce migraines and help women better manage their symptoms so they can get back to saying yes to life. So Tanya, welcome to the show. I am super, super excited to hear.
Thank you. Thank you for having me. I'm excited to be here. We didn't know if this was going to be happening because, as everybody can hear, my voice is not awesome. I'm just getting out of a week-long COVID bout, but I'm here. We're here, and we get to do this. So I'm excited to be here.
We made it. Very good. Okay, so tell us a little bit about your journey to treating your own migraines and how that changed your career.
Well, when I actually didn't know I had migraines for many years. I just thought they were really bad headaches that I would have all the time, and that's kind of what my doctor told me. And then, take some over-the-counter meds and you'll be fine. And so when I went to medical school, I realized, wow, these are undiagnosed migraines that I've been having most of my life. It started when I was involved in a car accident when I was 16, and they just got progressively worse from that point forward until I was having a headache. I was living in a constant headache every day, and then I would have flares into migraines multiple times a week. So when I went to medical school, I was obviously very interested in learning how I can address my own issues, and learned about diet and gut health and all of the things, hormones and adrenals and stress, and how all of these things play a role in how I was feeling, and started working on myself. And so when I graduated from med school, I was pretty much headache free at that point. Like, I had figured it all out. It took me 4 years, but I did it.
It's amazing.
And yeah, it was, especially after, not having any support for so long. And then, I would just get super excited when people came in with headaches. Not that I was excited they had headaches, but I knew exactly what I needed to do to take care of them. So I was always excited when that was their main complaint, and was always very effective at being able to help them with their migraines and their headaches. And that just kind of led me down the path to where I am now.
Awesome. So do you still struggle with migraines sometimes? And if you do, what do you do to get rid of them fast?
I haven't had a migraine in 9 years now. I do still occasionally get headaches. Sometimes, most commonly, they're either related to when I'm sick, or, which is not uncommon, or when some hormonal stuff. And so, well, I guess there's a third time, and that's usually when I'm not taking care of my body, as far as, making sure I'm resting and doing self-care and diet. So yeah, to treat myself, it's more kind of self-assessing now that I understand what's triggering. So one of the things that a lot of people don't know is that we don't have just one kind of migraine. There are usually multiple migraines that we struggle with, different causes, I should say, to those migraines. So for me, I was having a food reaction migraine. I was having a stress reaction migraine, and I was having a hormone reactive migraine. And I didn't recognize that they were different I was just in a lot of pain. So, but I didn't realize that those pain syndromes were actually a little bit different when I started paying attention to them. And so when I started to understand, hey, when I feel this way, this remedy works and these don't. And when I feel this way, this one that usually works doesn't work. Then I started understanding, okay, I have to actually treat what's triggering my migraine, not necessarily treating a migraine in a standard like this is what you do for migraines. Does that make sense?
Yeah. You treat the
Yeah,
cause instead of just attack the pain.
that's right. And so once that light bulb clicked on, now I'm able to just assess, all right, what have I been doing? How's my stress level been? What's sleep been like? Where am I at in my cycle? I go through the list of questions. I'm able to identify what the problem is. And, usually within 2 or 3 hours, I'm able to identify the right things to do, whether that be, and I don't take medication. So it's either going to be related to, some stretching and some exercises, or it's going to be related to doing some supplements, anti-inflammatories or hormone support or things like that.
Gotcha. And you said something interesting there that I'm hoping you can expand on a little bit. So you definitely distinguish between a migraine and a headache. And normally when I talk to migraine sufferers, any headache is a migraine because they get migraines. Um, so can you expand a little bit? Because I honestly don't know. What is a migraine physiologically? Like what's going on inside the head and how is it different than a headache?
Yeah, that's a great question. So a headache is usually a part. You can actually have silent migraines where you don't have pain, but you have the neurological symptoms of a migraine. So the important diagnostic pieces is that you have at least 5 headaches that have lasted between 4 and 72 hours that are not treated by, regular, Advils or something like that, and that they have two of the following, like there's a list, right? And they have to have two of these. So it's in one specific location, it's pulsing in intensity and the quality of the pain. It's moderate or severe, so something that is pretty significant. So it's not just like oh, I've got a nagging headache kind of thing, right? And then it's aggravated by doing routine physical activities like walking, climbing the stairs, doing the dishes, whatever it is. And on top of those qualifications, it also has to have at least one of the other following things, which is nausea, vomiting, light sensitivity, or sound sensitivity. So if you have that constellation of symptoms, then that headache is a migraine.
Okay. Gotcha. 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 So is there, what exactly is going on? Is it just neurological or is there a vascular component also? Is it kind of all of the above? Like,
Yeah,
are we
yeah.
having just
So
inflammation in vessels or inflammation in nerves?
yes. Yeah,
Oh,
so we don't there's a lot of different theories on what's going on in the brain, what's causing the pain, why it happens to some people and not to other people. And what we do know is that it's just a multifactorial thing, right? It's not as easily definable from a diagnostic standpoint as say Hashimoto's or hypothyroidism, where there's definite diagnostic and lab work criteria that can tell us this is what's going on. With a migraine, we have kind of all of the above. So one thing we do know is that there is a very odd hyperexcitability that happens in a migraineur's brain. It a lot of times, like there are people that say, well, it's not vascular related, it's actually inflammation of the nerves. There are other people that say, well, it's totally a vascular thing. My experience is that it's both, right? It can be triggered by extensive sensory input. It can be triggered by low blood pressure. It can be triggered by high blood pressure. So there's definitely components of all of the above. One of the most common components is that there is a vascular piece to it where the blood vessels will relax in the brain that increases that pressure because, the blood vessels are getting wider. And that can kind of trigger this cascade of hyperexcitability as the brain is sensing this expanded pressure, and that then will kind of spiral into a migraine, which is why in a lot of cases, triptans are very effective. But There can also obviously be cases where triptans don't work or they make the situation worse. So then we have to look at, well, there's neurotransmitters involved and how do the triptans affect those? There's hormones involved and triptans don't affect hormones pretty much at all. So you're not going to have any effectiveness in treating a hormonal migraine with a triptan in most cases. So
I
then,
okay, forgive me for being dumb. I don't know what a triptan
oh,
is.
I'm sorry. Yeah. So a triptan is it's the number one kind of first line go-to medicine for migraines.
Okay.
So
Okay.
it works on the serotonin pathway. So serotonin is a neurotransmitter that is highly implicated in migraines, but again, it's not present in all of them. So there's never a 100%,
Interesting.
diagnosed. It's a serotonin issue, it's a high blood pressure issue, it's a,
Yeah,
whatever. It's potentially all of those.
it's interesting. So triptan brand names, I'm trying to remember, is Imitrex
Imitrex, right.
is like the biggie. Okay.
Yeah.
And I'm guessing there are
Amitriptyline.
other generic
There are
forms of that. Okay.
elatriptans and I mean
It
there's a
works on the
few.
serotonin system, but that makes me think of like your standard SSRIs, like your antidepressants, like Prozac, Lexapro, that also
Yep.
work on the serotonin system.
Yep.
Are they, is Imitrex and other triptans, are they trying to, does it work? I'm guessing the mechanism is probably different.
It's more acute than an SSRI is. They do work on the same system, but they do work a little bit differently. And in a lot of cases, SSRIs are used as more of a preventative. So you'll have a lot of migraine patients on SSRIs. One, because depression is a very common comorbidity with
Yeah,
migraines,
I would
but
bet.
also as a preventative, if there is a serotonin component, to try to help keep those serotonin levels elevated so that they're not having the dips and drops that can trigger the migraine. So,
Gotcha. Gotcha. But it's only, like you said, that's only one piece. And it
right,
only works if serotonin is a component in their
of
migraines. But
that
if it's not,
particular migraine. Yeah.
yeah. But if
And
it's,
the confusing thing is that one person might have a serotonin-based migraine and their Imitrex works 90% of the time, but then there's like the 10% where they're like, my Imitrex does nothing. I don't understand why it works most of the time, but then sometimes it doesn't. And that's when we're looking at maybe it's a low cortisol issue, maybe it's a low um uh it's a hormone issue or a drop in estrogen. Maybe it's a stress triggered one. Maybe it's inflammatory related to something that you ate that's not being, responsive to the triptan. So that's why it's really important for them to understand that the different migraine symptoms that come along with their migraines will help them to understand a little bit more about the type of migraine that they're having. And in the simple cases, they just have one kind, right? Where the triptan works, they take it once or twice a month, they're good to go. That's a well-controlled migraine case. I tend to see the people where they're like, sometimes it works and sometimes it doesn't, and sometimes it makes me feel worse. So I don't know. Should I take it? Should I not take it? And
yeah,
then what other options do I have? And so those are the cases where there's more than one thing going on, and we really need to do the work to dig in to figure out what those things are so that the right things are being addressed for them.
I'm guessing for one, I'm guessing that like an SSRI, I'm guessing triptans have side effects in some people more than others. And I'm
Correct.
guessing that especially with your more complex cases, you're probably seeing people who it's their goal to get off of the Imitrex or get off of their antidepressants to where they don't need them anymore. Is that the case?
Most people would love to not have to deal with them, right? There's a lot of weight gain and there's mood issues that go along with things that they're
That
taking.
sucks.
It does. It really does. Appetite change, all kinds of things that happen. Most of my clients want to get off their medications. Some of them couldn't care less. They just don't want to be in pain. So,
Yeah.
really the goal is up to the individual. And, if we can find a solution that works for them, either with or without medication, then absolutely. Like that's what we
Yeah,
aim for.
that's the goal. So when you're looking at all of these more complex cases, and I think you've already touched on it some, but what would you say are like the top five triggers of migraines?
Yeah. So, hands down stress, like just right off the top. If we could get everybody working on stress management and self-care and quality sleep, that would probably take care of 90% of the problems, right? Um, but other than that, exercise tends to be a really big trigger. And there's a couple of reasons for that because of the spikes in our catecholamine neurotransmitters, which are our stress neurotransmitters. So we tend to get spikes in our adrenaline and noradrenaline when we're exercising, which is good. It's a good thing. But for a migraineur, the spikes can actually trigger a migraine, and the withdrawal after they're done exercising can trigger a migraine. So that can be, that's another kind of neurotransmitter piece that's not really affected to serotonin, but we need to be looking at their catecholamines and see, all right, are they having an epinephrine norepinephrine problem? It can also be related to energy output of their cells from a mitochondrial standpoint. So a lot of people haven't heard about this connection, but there is new data that shows that mitochondria, which is the energy productor or production piece of the cell that gives our cells the ability to function, that people with chronic migraine, chronic fatigue syndrome, fibromyalgia, things like that they actually have a low mitochondrial output. So whenever I see, them being physically active, even if it's not exercise, but it's like they do, 15 minutes worth of chores because they're feeling well enough to do it, and then suddenly they're down and out with a migraine, that's not really enough to trigger that epinephrine norepinephrine response. That's probably a lack of energy production. So then we want to focus in on mitochondrial support, which can make a huge difference in people with chronic migraine if they're not producing enough energy at a cellular level, because the brain needs so much energy, right? And so if it's not getting enough energy, it feels like it's dying. And then when that happens, it goes into fight or flight mode. And then suddenly we've got this cascade of events that you can't stop. So that's another piece. And then I often see diet. There's a lot of dietary triggers out there, which kind of stems back more, not necessarily to the diet, although we have to have a clean, anti-inflammatory whole foods diet for sure. But it's not, if you react to a ton of foods, then there's probably something else going on from a gut standpoint. So we really want to look at that. And then time of day is a big one because of some of the circadian rhythm pieces that our body puts out hormones at certain times. And sometimes the ups and downs of those fluctuations will be a trigger. So if it's triggered at the same time every day, we want to take a look at, all right, is it a cortisol issue? Is there something going on from a thyroid standpoint? Is there something going on from a hormone standpoint that we need to address? And then the last of my top 5 would be weather. And so this one, people feel like, well, dang it, like there's nothing I can do about this. And that's actually really incorrect, because weather triggers are usually a result of serotonin drops, because low pressure systems will drop our serotonin physiologically. That's one of the reasons why I think SAD is so prevalent, seasonal affective disorder, where you get really depressed in the winter. When we have
Huh?
so many storms coming in, our serotonin levels are so low. I think that is
I had
possibly a
no idea.
component. Yeah, it's really interesting.
Interesting.
So if we work on supporting serotonin via diet, so by doing things like eating healthy, good whole grain carbs and other foods that can boost our serotonin levels, you can actually ride out a storm without the need for any medication. And then there's things like 5-HTP and melatonin that can also help to support during, big storm pieces. And so that's actually one of the easiest of the migraine triggers to treat, because it's physiologically, it's just about supporting that serotonin.
Direct cause and effect. That's
Yeah.
so fascinating. Okay, so that's probably a good segue too into my next question. So, what are some of your favorite go-to strategies for treating migraines in your clients?
So, we have kind of a very comprehensive approach. One of the things that we really, really advocate right off the bat is starting to understand what our symptoms are telling us. So one of the first things that we want to do is to help the client understand what exactly is going on in their body and what their symptoms are telling them. So we really want to start closely tracking the symptoms related to each migraine, which can be hard to do when you're in pain. But if you can start to understand, like, sometimes you get the stabbing behind the eyeballs, and sometimes it's an ice pick in the back of your head, and sometimes it starts at the base of your neck and it starts to kind of crawl up. Those are all different symptoms and different types of migraines, right? Those three different examples are not all going to necessarily be treated with the same thing. They might require different treatments. So then it's a matter of understanding, okay, well, now what symptoms are associated with what problems? And we want to start looking at hormones. We want to start looking at stress. We want to start looking at diet. We do a lot with structure and understanding proper body mechanics and posture and how that plays a role, especially when we're, working or at a computer. We want to take a look at how our adrenals are functioning and what our cortisol levels are doing. And then we also really want to pay attention to mitochondria, as I mentioned earlier, and our detoxification pathways, because there's been some interesting research over the last decade that has shown that people with chronic migraines are actually very deficient in their major antioxidants, which means their bodies cannot process toxins the way somebody without this problem can. And then those toxins will just sit in their body, wreaking havoc and causing inflammation. So we need to work on getting those toxins out of the body to allow their body to be more resilient is the word I'm looking for.
Wow. Yeah. Okay, I have an idea. Do you want to play a fun game? And if not,
Yes,
that's okay. We'll edit it out.
I would love to play a fun game.
So I have always been curious about what the cause of my headaches was when I was in dental school. And
Okay, yes, let's do it.
I had a doctor who said, they sound kind of migraine-y, but not really sure. And at the time I was not very holistically minded. I just didn't know. So here's what would happen.
Okay.
It was, and I don't get them anymore. Like, it's very, very rare that I get them now. They would happen on a Friday night without fail. A
Okay.
Friday after school was done, after I was done with
Can
all
I
of my
pause you
clinic.
for a minute?
Yeah.
The first thing that comes to mind is what your cortisol levels were doing, right? You had a busy week, your
Mhm.
cortisol levels were up, you were probably studying through the week.
Mhm.
Friday's your first chance to let down and de-stress. I want to know
Yes.
what your cortisol's doing. Okay,
Yeah.
continue with
And
the
I'm
game.
like, what the heck? I finally feel good and I like can relax and want to go do stuff. And I have this stupid headache. And it was always, I thought it was a sinus headache, but I never had a runny nose. I thought it was maybe allergies because it was downtown Dallas, so smog was probably a factor. But it was usually right eye and kind of a stabbing feeling behind my right eye. And Sudafed was my go-to.
Mm,
It always worked. I always felt amazing because you get that like rush afterwards from the
uh-huh.
Sudafed. So I could like get up and clean the apartment that I was in or study some more and get caught up over the weekend. Um, but Sudafed was my go-to, always stabbing behind the eyes, always Friday night. If I couldn't get it under control, it would last into Saturday.
All right, so now I'm going to revamp my theory a little bit.
Mm-hmm.
And I don't think it's cortisol. I think it's more related to your catecholamines. So again, the acute stress neurotransmitters, it still is related to stress, but
Mm-hmm.
Sudafed works on that norepinephrine pathway. And so if Sudafed was what it was what your go-to was, then most likely what was happening is you had a chance to relax after a really stressful week and your catecholamine stress neurotransmitters tanked and you got the migraine. And so when you took the Sudafed, it helped to boost those that norepinephrine up and you felt great again.
Ah, so Sudafed helps to boost norepinephrine, epinephrine, catecholamines.
Well, yes, it helps to release the norepinephrine and it also helps to stimulate those receptors as well. So it's kind of doing both.
Okay. Gotcha. Gotcha. That's so interesting. Now
And
I
so
know.
that's how we can kind of use your symptoms, your patterns, and what medications you
Yeah.
responded to really understand, okay, now we're going to do some neurotransmitter testing for you. And we're going to
Mhm.
see, oh, yeah, it looks like you're really running low on your neurotransmitters or conversely high. And then we know, okay, we need to moderate that. So the recommendation for you would have been, all right, you need to work on stress management through the week, right? You need to be paying attention to your breathing while you're in school and doing your work. And then you also need to consider things like rhodiola and L-theanine, which can help to moderate your spikes and drops in the catecholamine neurotransmitters. So then we start really kind of honing in on the problem for you. And then you're like, okay, well, that took care of that one, but now I have one every 2 weeks. What's that about? Okay, well, that's
Mhm.
probably going to be a hormonal thing, right? And so then we start kind of unraveling all of these different things that feel like the same. Does that make sense?
Yeah, yeah.
Yeah.
Oh, that's fascinating. That was cool. Thanks.
Yeah.
Hopefully that helps somebody else.
Yeah.
Okay, now let's veer just a little bit because I'm interested in all things mouth related.
Mouth stuff.
Mouth stuff. Do you ever find that TMJ dysfunction, that TMD can sometimes trigger migraines for people or headaches? And so what would your like different strategies be for those types of migraines?
Yeah, absolutely. In fact, we have a whole lesson kind of module around TMJ specifically. There is a very high correlation between people with chronic migraine and TMJ symptoms. So what we do mostly focus on it's kind of like a three-phase approach that we use. And of course, if you need dental devices and things to help, that's absolutely there. But it's kind of a last resort option if none of the other more minor things work. So the first is we need to take a look at why that area is so tight. It can be related to stress because we're clenching. It can be related to inflammation, maybe things that we're eating that's causing inflammation, that's causing those muscles to clamp down. It could be because of the mitochondria piece that I mentioned, where we're just not getting enough energy to those muscles. It could be related to lack of oxygen to those muscles. Again, because we're not breathing, might be related to stress, might be related to just poor breathing habits that we get into as we go through life. So we want to kind of take a look at, some of those foundational pieces as usual, right? It's always what's causing the problem. So we want to kind of investigate that. But then we want to, kind of clean up the diet as we're doing for the migraine piece anyway, because that's going to help us identify if there are any food triggers that could be contributing to that muscle tension. And then we want to do some self muscle release actions at home. So there's a muscle, which I know Dr. Tony, called the lateral pterygoid that helps us to, or it causes our jaw to close. And that's what it gets really, really tight when we're clenching our jaw. So we can actually go in with our fingers into our mouth and touch that muscle. And just like if you're massaging a knot in your shoulder, you can do the same thing in your mouth. And so we teach our clients how to do that. And it's really painful and really uncomfortable until you're able to kind of release some of that tension. And then it starts to become like, oh, there it is. It's relaxed. That feels good.
Yes.
So we
Yes.
teach them how to do that. And then last but not least, we want to make sure that people are going in to be assessed chiropractically for cervical C1, C2, mandibular movement, things like that, to make sure that there's not a misalignment that is contributing to the muscles being tight and trying to hold things in place when something is out of place. And so we want to make sure that the structurally things are sound.
That really is exactly how I deal with TMJ issues too, in those orders.
Love it.
I just can't address it from a migraine standpoint, but yeah, I do the
Yeah.
exact same thing. Some kind of mouth appliance is last resort. Um, we practice self massage. I tell them how to get their fingers in their mouth and really find those knotted up muscles and do the
Awesome.
release themselves.
I've
Um,
actually never heard of a dentist giving any of those tips. Can I just say kudos to you, Dr. Tony? That's amazing.
oh, I gosh, they should be. That's so
I
easy.
I know. Yes, I'm with you, but no,
So
I've never
easy.
heard of that. Yeah.
Yeah, especially in the shower in the morning. That's my
Yep.
favorite time because it's usually most tense because you've been clenching at night. You
Yep.
get in the shower where things are moist and warm. And I usually say, take the thumb of your opposite hand, go in there, like in between your
Mm.
top molar and your bottom molar, and find that spot. Find
And you will
it.
know it when you hit it, right?
You
You
will
will
know
know it
it.
when you hit it.
Yeah. And then make it hurt till it feels good.
Yep. Yep.
You know what's interesting is that and I've practiced with this a little bit. It takes a little bit extra time chair side, so I don't get to do it all the time. But there are some body workers, like some really skilled body workers, that I refer some of my TMJ patients to if I can like things are just knotted up and they're this tense mess. And this one body worker her approach is the opposite, but it's so cool because it works so well. And this will sound totally woo, but that's okay. She'll find the spot and train you where to find the spot, but she doesn't put pressure. It's like just touch and intention.
Oh, and it
Uh,
still
and
works.
and it still works.
That's
And
interesting.
you find it, you're like, okay, yeah, that's the spot that hurts. And then, and she says in her like super hippie way, she's like, just you need to give that area some love, tell it it's safe, it's
I love
okay to
it.
relax.
My
Um,
acupuncturist does that to me when I get acupuncture done, and she finds a hard spot, and she'll be like, "It's okay, just let go. Thank you so much for the burden you've carried, but you can let it go now." And then it does. It
and then
just
it does.
relaxes. It's just the
Yes.
weirdest thing. I love it.
Yeah, I love practitioners who don't feel the need to brute force everything.
I know. Well, you know what? That is such a painful, like it literally brings tears to my eyes when I do it. And
Yeah.
if you can save your patients from having that kind of like tear bringing pain, I'm all
Yeah.
for that. Maybe I need to kind
Seriously.
of relook at my technique.
Or come down to Texas and I'll introduce you to it's Marnie Mateus. She's fabulous. She's at Kikino. Come down to Texas. I'll treat you to a session.
Good job, Marnie. I love it.
Okay, so other areas of tension that I see in the mouth are tongue ties, tongue and lip ties. Again, we're
Hmm.
looking at now it's not just muscle tightness, but more of these fascial restrictions. So have
Yep.
you seen any correlation between tongue ties and migraines?
So I know of it. I actually have not seen that as a major issue in my client population. Although I will be honest, it's not something that I bring to their attention to assess for. So this I've only recently become aware of this link over the last year. So I actually need to put this into my program as a potential cause. But yeah, so kind of after I learned that this was a thing, I kind of dug into the research a little bit, and absolutely because of how it causes tension around the hyoid bone, which is kind of right here, right below the jaw,
Mhm.
that will cause the head to be pulled forward, which will misalign the spine and cause muscle tension that can be a trigger. So,
Yeah,
so it's definitely something that, and apparently it's not
possible.
uncommon to have a missed tongue tie in adulthood because
Oh,
it's
for sure.
minor enough that it didn't affect the children. And you can probably speak to this better than I can, Dr. Tony.
It's well, and I have not seen, I don't personally have any clinical cases that I can think of where it was triggering migraines. But also, like you're right, the diagnosis is hard because we've changed the bar so much over the last 10 years, 20 years. Um, where 20 years ago, when I was in dental school, we were never taught about tongue ties at all. And I had a baby who we had a really rough nursing experience and and I didn't realize until much later that it was, yeah, she was tongue tied, and if we had known that, we could have revised it and hopefully, you know, improved the issue. But so there's a ton of, I'm tongue tied, I have not had mine revised yet, but just didn't know because I compensate well enough, even, you know, through childhood. I didn't have any speech issues. I actually nursed okay. But that's where we see these, okay, like if we release the tongue tie, then all of a sudden, yeah, you're freed up to where you don't have to have that forward head posture anymore. It relieves tension in the traps, so your shoulders have less tension. So it makes sense that, yeah, if there was some spinal issues, forward head posture, some tension in the neck and the shoulders, where that could be a trigger for some people if they're struggling with migraines.
Yeah,
So it makes sense. It makes sense.
yeah, it does.
Um, Now, weird question because I like percentages. So, as a percentage, what would you say the importance of spiritual and emotional health is with your clients healing from migraines?
As far as like potential contributing factor or how important percentage wise is it to treat?
Oh, maybe both.
Okay. I would say in the overall picture of how important that is, I'd say it's probably like a 90%. And all of the other things that we've talked about are like a 10%. There is so much data on people with childhood trauma, people with diagnosed PTSD, and they have 2 to 4 times higher levels of migraines or higher numbers of migraines, I guess, than people without those experiences. And so this is absolutely huge. The role that unconscious beliefs and thoughts and emotions and traumas that we now know, we don't know how, but we do know that I mean, even, well-known journals are starting to publish that there's somehow emotions are being stored in our physical bodies. We don't get it. We don't know how it happens. And it does sound woo because it's not something we've ever looked at before, but they're starting to recognize like there is definitely a correlation here between traumas and emotional issues and chronic issues like migraine, fibromyalgia, chronic fatigue syndrome, things like that. So this
Yeah.
is absolutely extremely important. And I would say 100% of people need to be looking at and addressing. And this is something that we spend weeks on in our program as well, is kind of assessing and looking at emotional barriers, emotional traumas. Have you worked through everything? And can you talk about what happened? And if you can't talk about it because, it makes you uncomfortable, nobody wants to, but can you? Some people just can't. And if you can't, even though you've done years and years of therapy, you're not ready yet. Like there's still issues that are unresolved. You should be able to talk about it. Doesn't mean you should want to talk about it, but you should be able to talk about it without having any kind of physical discomfort or increased heart rate. Like it should just be another story that you tell.
Yeah.
And that's usually a lifetime, right? If you ever even succeed. So
Mhm.
I have a lot of clients who are like, well, I went 2 to 3 years of therapy and I addressed those issues. And then they're like, I don't want to talk about that anymore. And I'm like, okay. And I get that. And I'm super sensitive to that, but that's going to be a sticking point. And so we just have to have that conversation. And if they still aren't in a place where they're ready to let go of those emotions and deal with that trauma fully, or continue dealing with it, I should say, not that they haven't dealt with it, but then, there's always going to be this ghost of an issue that's contributing to the migraine picture, right? And um, so it's a really, really hard conversation to have and to really truthfully assess whether or not, even if you've gone through a decade of work, is it enough? Has it been enough? Have you fully been able to let go? And really, the highest percentage of people that I've found that can talk about it are those that have also engaged in a spiritual or religious practice that has allowed them to move past the physical traumas that happened, and relying on their relationship with God to help them move through that. And the ones that and I bring that up because I feel like it's very, very closely tied. And there is, again, so much research on how having regular religious practices and having a relationship with God outside of your own being will actually improve outcomes across the board in chronic issues, from cancer to autoimmune disease to migraines. There's research on dental health and spirituality. So this is like a huge piece, I think, that we're missing in the medical community, that we're not addressing, that will allow our patients and clients to be able to fully assess their emotional standpoint. Like, I don't know if we can get over things that happen to us on our own strength, right? I fully believe like we need God's help to move past some of these horrific things that happen. And I feel like that can be a piece of why some people get stuck in that and some people are able to work through it and let it go.
Mm.
So anyway, that was kind of a little bit of a divergent conversation there, but I
No,
think it's
I
so
love it.
important.
Yeah, no, I mean, those are huge numbers. That so for 90% of people,
Yeah.
spiritual, emotional stuff is a trigger, and for 100%, it's part of their healing process from migraines and from any, and I'm completely agree. And I see it. The body keeps the score. Those stressors, even emotional stressors, are stored somehow cellularly. And for each person, it's going to show up different as
Yep.
physical manifestations. And
Mhm.
it's just a matter of, okay, where is it showing up for you and how do we address it? And so you're right, addressing the emotional piece has to be part of it.
It does. It
I
it
love
does.
that.
And it's probably the hardest work that somebody has to do and the longest work. But
Yeah.
yeah, I think that alone will change your physical physiology. Like I think as practitioners, our first duty should be working on the spiritual emotional component of somebody and then addressing any leftover physical issues. Because honestly, if we work on those emotional pieces first, the physical stuff starts to resolve on its own, right? We start seeing less stress response. We start seeing people are able to get into their parasympathetic, which is their rest and digest, which is the opposite of fight or flight, where we should be living most of the time. And we as a
Healing mode.
society, what's
Yeah.
that?
It's healing mode.
Yeah, it is. It's healing mode. Exactly. And most of the time we're in fight or flight. Like very few people actually have heard of rest and digest. Everybody knows fight or flight. They've all heard that we live there, but
Yeah.
nobody really knows like we should be living in rest and digest and only occasionally being in fight or flight. And that's just not the way we see things. And so I feel like if we can just really work on that stress management, spiritual, faith, emotional component first and make that the focus of medicine, I think so many of our chronic diseases will just start to resolve.
Totally agree. Totally agree.
Yeah.
So what about oral health as a trigger to migraines? Do you see that? Have you noticed it in the literature, in your research?
Yeah.
Oral health, we've talked about TMJ, we've talked about tongue ties, but our bread and butter is cavities and gum disease. Can something simple like cavities and gum disease be a trigger for migraine somehow?
Yes. So there is, we now understand. I'll brag on naturopathic medicine for just a little bit. We've known for decades and decades the importance of gut health in everything from autoimmune conditions to neurology and brain cognition, things like that. And now finally, the conventional research over the last decade has really shown that the gut is a second brain. And it controls so much more in our body than we ever understood before. And what drives that is our gut bacteria. And so now we understand that our gut bacteria is extremely important in our overall physical health. Now I bring that up because where is our gut health? Where is our gut microbiome coming from? It's coming from our oral health. It's coming from the bacteria that we eat. It's coming from the bacteria in our mouth. And there's actually research that shows how unhealthy oral bacteria, it can predispose you to getting more illnesses, more sinus infections, more gut issues, which then in turn leads to inflammation and problems, increased blood pressure, increased cardiovascular risk. I know I don't have to tell you, Dr. Tony, and I'm sure your listeners are all familiar with this research, right? And so with migraines, it's no different. If we're not taking good care of our oral health, if we are having a lot of inflammation and gum disease, if we don't have good bacteria in our mouth, that is going to affect our migraines via that gut-brain axis. And our gut is just, we didn't really even touch on the importance of our gut in treating migraines. But even if you don't have any problems with digestion or food or, bowel movements or anything like that, you're like, no, my gut's fine. If you have migraines, your gut is not fine. I can 100% tell you your gut is not fine. There's stuff that we need to do to work on that because of that such close relationship between that gut and that brain. And so, the same can be said for the gut and the mouth. If one is unhealthy, absolutely 100% the other is unhealthy. So I can confidently say, using the logic we learned in like 8th grade math or whatever, if you have migraines, then wait, no, what is it? If you have migraines, then the gut is involved. And if you have poor mouth, then it will affect the gut. So then I can conclude that if you have poor oral health, then it will affect your migraines, right? So we can make that logical conclusion, understanding the connection between all these. And in fact, there is research that shows that people with poor oral health have a higher incidence of headaches and migraine issues. So it is absolutely very, very important to our overall health, and in particular, and to our migraines in general, and our migraines in particular.
No, that's awesome. And that's good fuel for me, where we have those rare cases where we have to convince patients that their oral health is important. Like, yes, I see all these bleeding gums and your mouth looks like a hot mess clinically, but it's not hurting them. So they're like, okay, whatever.
Yeah, right.
But if they are also having migraines, then how cool is that if we could provide a tool that supports them in healing their migraines through healing their mouth, which in turn is part of healing their gut.
Yeah,
I love it.
absolutely.
Love it. Love it. Okay. I know we don't have too much more time, but I have a couple of more lighthearted questions.
Okay, lay it.
So I know in dentistry, and I think it's true in anyone who helps with chronic health issues, patients have amazing excuses on why they don't do what we recommend that they do. So what are some of the best or silliest or funniest excuses that clients give you?
Yeah. I have to say that I feel very blessed in the fact that most of my migraine patients are very dedicated. Like, they've come to do the work, and they might not be happy about it, but they'll do it. However, there's always a few that don't want to. One in particular, we were able to figure out, a few of the things that were triggering her, and she went from daily migraines to like 6 a month. And she told us that it was because of what we had changed and some of the medication changes that she had made on our recommendation based on what we were learning about her body. And she was like, well, I'm not going to change my diet because it doesn't seem to make any difference. And you didn't really do anything, because as soon as we changed the medication, then that kind of resolved the problem. So I'm not going to do the stress management stuff because that didn't seem to work on anything. And I'm not going to do the dietary stuff because that didn't seem to work on anything. And I was just like, okay, but like, okay. I mean, I just didn't know what to say to that. It's like, we were able to figure out like what was going on for you.
Yeah.
And yeah, we needed to make those medication changes, but like, you stopped halfway through. Like,
Oh my gosh.
yeah.
Yeah. Yeah.
So that one was a little frustrating, because it's just like I could see the light at the end of the tunnel for her, and she just didn't want to put in that effort. Which, if she was happy with 6 migraine days a
Hard.
month with the medication changes,
Yeah.
then good. Like, I'm happy for her, but I saw 0 days for her in the future, and she just didn't want to get there. So I guess I don't know. I don't find any of the excuses funny, because to me, they're more frustrating, because it's like I can see and hold that hope for them that maybe they can't see, which
Yeah.
might be a little bit different in dentistry, because it's not such like a life impacting, well, it can be, but in general, I would assume that
I
most
totally
of your
get it.
clients,
I totally
yeah,
get it. Yeah.
yeah,
When they're in, especially when patients are, in younger to middle age, and they're not necessarily seeing the clinical, they're not having
right,
pain that's motivating them to take real change, like real action that
yeah,
lasts.
yeah,
Um, no, that's good. Okay. I put you on the spot just a little bit. And I too, for that patient, like I've found that some patients are, again, going back to emotional, mental, spiritual
yeah.
health stuff. Like some people hang on to their illness.
They do.
Like
They
there's
do.
something that they get out of being sick,
It
whether
becomes a
they
part
are
of their
conscious of
identity.
it or not. Yeah.
Yeah.
Yeah. I absolutely see that. That's true, I think, across the board for
Yep.
all health topics.
Yeah. I
Um,
100% agree with you. And I do think that was part of the case for her.
yeah, she didn't want to get completely well. She was well enough.
Yes. And I was very happy, at least, that she was down significantly anyway. So
Yeah. Yeah. Well, give our audience, I know you need to jet. If you could give our audience any parting words of wisdom or words of hope that you would like to share for everybody.
I love this question because that's the key word is hope, right? So many of the women and men too that I talk to are at their, I think, they've been given up by their neurologist. They're like, we tried all the medications, nothing works for you. Like, this is your life. Hopefully it'll get better after menopause. And I just want to say that is so not true. There is so much that we know about migraines now. We can't put it in a nice, neat, tidy little box. And so, unfortunately, conventional medicine doesn't know what to do with those cases that aren't in nice, neat boxes. But there is stuff that we can do, and it's work. But I know that the people that this is resonating with are not afraid of that work. They just need to find that hope again. So I just want to say that our most common clients, they usually come to us with, they started in their having migraines either in childhood or early adolescence, and they've had it their entire lives and it's gotten worse. And now they're in their late 40s or 50s and they're coming to us and they have 25 to 30 migraine days a month with very little response to medications. And they've tried everything and they're basically at their rope's end. And we're able to get them, our average reduction rate is 91%. So our average client drops their migraine days by 91%. So that usually looks like 2 to 3 migraine days by the time they're done working with us. So, and that might not be perfect, but it sure allows them to live their life again. So I just want to say that if anyone is listening and you're at your wit's end and you don't think that there's any hope for your migraines because your neurologists have all told you, even your headache clinics and the specialists and, the top tier in the country, there's still stuff you can do. So hold on to that hope. Don't give that up because you don't have to live like that.
Wow, I love it. I love it, love it. And we are all about taking our health into our own hands. We are our own best doctors. So if you get 10 doctors that tell you it can't be done, and you know in your heart that it can be done,
Yes.
then absolutely reach out to somebody like Dr. Paynter, and have hope. I
Yes.
totally agree. I love that.
Hope.
All right. Well, Tanya, thank you so much for your time today. We will make sure that we put links in the show notes where everybody can find you and have access to, because you're online, correct? So
Correct.
you can treat anybody anywhere. So we'll put all those links in the show notes for you, and we will catch you guys next time. Bye for now.